All right, welcome back to another Friday series of the Slice of Life, the project, and I'm excited. This is good. I feel like we're kind of back on track. I just finished some recordings for the Monday series on inventory, material, physical items, right? So I made a little analogy, like inventory mukbang. Although I hate the idea of what people do. I love the concept and idea of a mukbang. I just don't like the execution and the way it's just a big waste of really, really good food. And anyways, so moving on. Let's cover some information. So this is a Friday series, of course. And you know me, I love Chubby Emu and his Medical Mondays. And I guess you could say, I'm doing something fairly different, but it's still, because he does a case studies and series on specific patients, and we keep in alignment with the whole. Just like he uses initials to designate patients, so do we also use single letter initials to designate. We don't even use like JL, we just say J. For example, that I use that initial a lot because there's a lot of names that start with J, like John Smith and Jane Doe, right? The standard universal patient identifier. So what we're going to be talking about today is a continuation of, and it's crazy to think that this is going to be up there like in March or something like that, right? It's so far ahead. But anyways, it's going to be on, last time I believe we covered CKD. CKD is a chronic renal disease. And so today we're going to cover, I'm such a nerd, Medical Mondays. So, all right. So this is going to be renal cancer. All right. So a lump on kidneys. Okay. So we have about 5, 6, 7 tabs here. I'm excited. So let's get started. So I just went on, okay, so Microsoft Bing, let's just search up, right? A lump on, so the basic symptom you might find is a lump on the kidney, which you will not feel usually. It'll be fairly asymptomatic. You won't have any symptoms until usually when it's like third or fourth stage. Sorry, that was for CKD. That's different, is it? No. Anyways, you won't usually feel anything until and there's a lot of reasons why you may feel some discomfort, or like there's some sort of protrusion coming out from the lower back end side of your abdomen, right under your rib cage, because that's where your kidneys are, on your left and right hand side of the rib cage. So so let's just read it. Copilot answer. Right, so there's a variety of different reasons, right, involving like the most common like cause you would come to mind is usually, or a risk factor for that is usually kidney stones. You would first think, oh, it's probably a kidney stone or something like that, which is not good. That's not good, but no. So a lump on a kidney can be caused by various conditions, right? It's not necessarily, so kidney or renal masses, these growths can be cancerous or benign. Imaging tests such as ultrasound, MRI, CT scans can be used for diagnosis from Medical News Today. Or it could be a simple cyst, which is just a harmless fluid-filled bubble, which again they could detect through MRI and CT because they can differentiate between solid and a liquid constituencies. We have simple cysts, complex cysts. Complex are very, because that could be a malignant tumor, right? So the one that's actually very aggressive and spreads beyond the kidneys into, I believe, we're going to get to this in a moment, but a renal mass that could be a sign of renal cancer can go and metastasize beyond the kidney to infect some very crucial organ systems, particularly your bone marrow, which is obviously, that's a life and death situation. Bone marrow, very painful as well, excruciatingly painful. So bone marrow, the liver, again, this will kill you, right? It can spread to the liver. Like that's fatal, right? And also I believe it was the lungs. So the lungs, the liver, and bones. And so this is not something you want to underestimate. You definitely want to make sure, you want to rule it out, you want to eliminate. So simple cyst, complex cyst, cancerous tumor requires medical attention obviously, and Wilms tumor, rare and is usually found in children. So if we scroll down here, 3 sources they've used on Microsoft Bing. What to know about a mass on a kidney, medical news today. Kidney lumps and bumps, is it a cyst, cancer, or a stone? Mayo Clinic, kidney cysts, symptoms and causes. Are round pouches of fluid that form on or in around the kidneys. Cysts can occur with disorders that impair kidney function. More often, cysts are a type called simple kidney cysts, and they aren't cancerous, and they ever cause problems. Okay, now of course they're talking about cysts here, and cysts, hopefully, if you have an issue, it's just a cyst. Unfortunately for me, I don't think mine is. I think mine is more dense, and so we're gonna have to go through some more testing, diagnostic imaging. What to know more about a mass on the kidney, and again, it's more because of the fucking crisis situation I'm plummeted into. It's really sad, but because I used to be really, really healthy, and now it's like just sabotage and ruin. Well, you can't do much about it. It's kind of inevitable, right? If you have like a whole population like turning in on you, it's all right, kidney cyst, but we fared very well. So there's that. No regrets whatsoever. We've done really, really well. And what to know about kidney mass on the kidney, kidney cyst, symptoms, pain, and treatment. WebMD, medical news today. Urologic surgeons of Washington. Kidney masses overview, symptoms, diagnosis. So that's it. I'm just gonna close this because we don't really need to go any further. Let's hop onto the next tab. So here we are with medical news. Okay, I thought I said medical news. Okay, so medical news today, not Monday. Get our weekly cancer care email. So join Healthlines. I gotta slow down, otherwise I'm gonna overexert my vocal cords. We already recorded 3 sessions. And one went bust, so that's 4 sessions technically. Join Healthline's Cancer Care newsletter to learn more about emerging research, nutrition, prevention, chemo, and more to support you through your cancer care journey. Join now today. All right, so no thank you. Well, maybe in the future when I get diagnosed. What to know about a mass on the kidney. Definition, size of mass, kidney cancer, causes, symptoms, diagnosis, treatment, outlook, summary. Medically reviewed by Dr. Megan Solomon, written by Jessica Caporiscio, PharmD, updated on PharmD. Interesting. That sounds like a degree that actually is fairly recent to our country. PharmD is a medical designation. I mean, well, yeah, it is. It's a pharmacy. It's a pharmacist. Pharmacists can now care for directly the patients and stuff like that, and make prescriptions themselves. And he's going further down. So, kidney or renal masses, that's because I used to train, but kidney or renal masses or tumors or growths that develop on the kidney. They can be cancerous or benign. In some cases, they may indicate an infection. Healthcare professionals can diagnose a mass on the kidney using imaging tests such as ultrasound, MRI, or CT scans. The treatment will vary depending on the type of growth. One type of mass that healthcare professionals can find in the kidney is renal cell carcinoma, RCC, which is a type of cancer. Early diagnosis usually results in a better outlook. So you go further down, there's a large table of contents. A mass or tumor refers to, does the size of the mass matter? Size matters. So that's what she said. All right. Tumors are less than 3-4 centimeters across, less likely to be malignant, cancerous. Up to 40% of 2-centimeter kidney masses are benign or non-cancerous, with only 10% being high-grade RCC. Nearly 30% of masses are talking size, are 4 centimeters or larger, are high-grade cancer. So further down, kidney cancer. The main concern for solid kidney masses is RCC, the most common form of BLA. 9 out of 10 people with kidney cancer have RCC. Anyways, going further down, other types include non-clear, transitional, nephroblastoma, renal sarcoma. Some benign tumors involve angiomyolipoma, which is it's filled with fat, really, oncocytoma, and metanephric adenoma. I'm not exactly sure what all of these mean. Some of them are more clear to me than others. Tumor size, nodes, and metastasis. That's usually what they do to check during the scans to see how far it has progressed, right? How far has it spread to your lymph nodes? Has it breached past the kidney to other organ systems? How large is it? Is it of an irregular shape? As we monitor it over the course of 1, 2, 3, 4 months, is it starting to grow rapidly and develop. Causes, different causes, benzene, herbicides, vinyl. So these are talking about chemical causes here at this point. Smoking is also a major cause because, of course, smoking 4,000 chemicals inhaling into your lungs, which then also eventually goes through the digestive system in other non-traditional ways as well, and then eventually your liver and kidneys have to filter through all those toxins. Some medications, including non-steroidal anti-inflammatory drugs, the NSAIDs, NSAIDs, although further research confirmed this. Going further down, they have a variety of symptoms. Genes play a role in this as well. I should mention that in the couple papers I had, I believe it was mentioned that when it comes to renal cancer, RCC, the major forms or risk factors when it comes to genetics, when it comes to mutations or DNA damage, is mostly environmental through lifestyle changes, and less so through something like hereditary or genetic. So you're not usually born with this. Usually it is something that is caused more from lifestyle and environment, which again makes sense for me, I think. Von Hippel-Lindau syndrome is another rare disease. Polycystic kidney disease, PKD, and Birt-Hogg-Dube syndrome is a genetic disorder. Signs and symptoms: renal masses, a new diagnosis of high blood pressure, high calcium levels in the blood. Again, this is more signs and more likely to be kidney stones, but still they kind of overlap, because if there's damage from a kidney stone or calcification of your glomeruli and the tubules, nephritic tubules, what ends up happening is that can be a reason for deterioration of the kidney, and it's in the histological tissues of your kidney, such that it starts to promote a hypoxic, dysfunctional, pathological environment for abnormal cell growth. More mutations, more inflammation, more prone and a greater increase exponentially of developing tumorous cells that can eventually proliferate and mutate further into something that is cancerous. And so it's not like there is absolutely a relationship between high blood pressure, hypertension, kidney stones, and of course also various tumor forms of the kidney. So going further into more symptoms: unintentional weight loss, night sweats, atypical red cloud. Most of these symptoms again are very benign. You can't really tell unless you go for a blood test. Diagnosing renal masses, and then further you have to get a CT scan. You have to get a radiologist to confirm. Okay, physical exams will not always detect a mass. Instead, they use imaging techniques like, there you go, CT, MRI, ultrasound. CT, MRI, CT scans appropriate when they need a quick image. MRI, professional may prefer when detecting small kidney masses because they're more sensitive and can pick up smaller lesions. Ultrasound usually it just distinguishes between solid and fluid-filled air sacs, so they can eliminate whether or not it's just a cyst or not. And then you have the further blood and urine tests. Now, treatment, of course, if you have renal masses, usually involves excision, surgical removal, but it depends on whether or not it's actually severe enough to that point. Biopsy, surgery, and thermal ablation are possible treatments. There are complications with these surgical interventions or treatment plans because they can involve infections, bleeding, and kidney failure, which is very severe. It does mean you have to live the rest of your life with dialysis, or maybe if you luck out and get a kidney transplant, maybe things can return back to normal. A good proactive measure in the meantime usually is active surveillance. Again, just constantly monitor the masses. Is it growing? Is it spreading? What's the morphology or the structure? What's it look like under a scan? Every couple months, 2-3 months, take a look, make sure nothing crazy is happening. How much is it growing? The rate of growth is not too extreme. Are there signs that there's more blood flow coming in and out? That can be very dangerous because it means that it is in a very aggressive type of cancerous tumor, right? That means it's metastasizing, right? Summary, and so on and so forth. So they have a link down here for more cancer resources. And now let's hop on to the next tab, because that was a lot of information. That's from Medical News Today. Okay, so here we are at the Urologic Surgeons of Washington. So this is apparently a board down in the States. So I don't know how far I went down here, but oh god, that's a maybe I should like censor this, the visual imagery here. You're literally watching and the surgeon dive into that's flesh, basically. That's human body flesh on the operating table there. Entry point to excision to the tumor, trying to excise that tumor. All right, here we go. So kidney masses, incidental discovery of mass in kidney. It's a commonplace occurrence nowadays with ultrasound, MRI, and CT. Of course, it can be very scary. Kidney cancer, you can find lesions. Kidney cysts can be normal findings, and if you have no suspicious characteristics, you might not have to do anything at all. During consultation, patient must bring their scan on disc. So here we are, kidney cancer, right? Here's what, this is the diagram. They go through on the side, on the right, about what you need to know about kidney masses. They may never need to be removed, right? Evaluation is necessary to make sure that it's nothing serious. Complex cysts need further testing to rule out solid masses, especially those that pick up blood are considered malignant until otherwise proven, right? It's best to just presume that it is at that point. And there's a whole article on why that is and the reasoning behind it, and I agree. Typically, we follow masses under 2.5 centimeters for further growth before treating. Causes, there are many and varied. Treatment, watchful waiting, assisted laparoscopic, radical nephrectomy. It's like radical. It just means like remove the kidney. Partial nephrectomy, that's just partial. You just cut off the part that, that is probably cancerous tumor. Laparoscopic nephroureter. I think that means like going further beyond the kidneys into the ureter. Outcomes are generally good with a 10-day to 2-week recovery before returning to work. Risks include pain, bleeding, infection, however, dislocation, bowel injury is possible. Rarely include urine leak and bleeding. Okay, so further down, right, some cysts are complex and carry risk of malignancy. So again, big issue there. Okay. Going further, so there they start talking here about the rating system. The urologist will assign urologist assign a Bozniak score. Right, like stage 1, 2, 3, 4 cysts. 2F will be malignant 5% of the time. Stage 3 cyst, Bozniak rating 3 cysts will be cancerous 50% of the time, unless there are comorbidities that preclude surgery. So it's really quite a serious issue if you do find that you have a complex cyst. It involves most likely surgical intervention. Classical thinking has been that 90% of all renal masses were malignant at one point. So they're detailing the reason here behind not really having to, right? So what's behind the assumption, right? This presumption is if you find that you have a complex cyst of a certain stage of development, like a certain size of 2.5 or beyond, 3 like millimeters or centimeters, I can't remember. Why would they just assume without going in there and collecting a tissue sample that it's malignant? And that's because with a certain probability rating, it doesn't really help you to acquire the information. So if we evaluate by case scenarios, presume that you acquire a tissue sample from that and find out that it's not, it's already a very invasive procedure that goes and dives into your organs that involves complications. You remove that tissue to find out that it's not, it's probably not, but it's a probable cause, like it's probably not, but it doesn't rule out that there aren't errors. So by virtue of taking this tissue sample and having a method of finding very inconclusive conclusions, ironically, it's not very informative, right? Because it tells you something that you can't have enough confidence on. So why bother with a test at all? And since most of the time that in the other case scenarios where it is malignant, you find out that in fact it is indeed malignant based on the tissue sample, then it doesn't change anything, because if you didn't go through with the diagnostic testing and removing the tissue sample, you would just realize that, hey, well, nothing's changed. We still have to go through surgery and remove the kidney anyways, or remove the partial component tumor from the kidney. So it doesn't change anything at all, which is why the assumption is there. At a certain level of the Bozniak score, you just realize you gotta suck it up. You gotta go through surgical intervention, usually because it doesn't help you to do further testing. It's just like wishful thinking at best, and that doesn't help you at all because, like I said, it's usually not a very high confidence result. So going further down, like I said, here's the imaging. I'm not sure exactly why. So further down here, several laparoscopic tools that Dr. Engel employs to perform laparoscopic kidney surgery. Robotic surgery is often used to dissect out the tumor from the kidney. Okay, so they use robotics. I didn't know. I'm learning along the way here, right? I'm not a urologist. And perform reconstruction. I love learning, right? Hand-assisted laparoscopy is a style laparoscopy where one hand is inside the abdomen, one hand outside. Performs it removed, or in high-risk cases such as chronic kidney failure, CKD, desirable to not clamp the blood vessels. Sometimes only standard laparoscopy is used for very small kidney. Going further down, the patient will consent to all approaches. The most common common cell type found kidney cancer is called clear cell, CCRCC. Clear cell, but variants such as papillary, sarcomatoid, medullary, and others are seen. And so they're just going through the variations and types of renal. So I'm going to go down and just move on to the next one because we've learned a lot about this, and I actually want to keep the tab open because I feel like I might want to refer to this as I'm naming the title.